Hello, it's Dr. Stuart Kozinn. I wanted to talk today about how we actually do the anterior hip replacement. What do we do? Well, if you start with an arthritic hip, you see the red area on the socket and the head. Those are the areas that grind and hurt. That's where the cartilage is worn out. So when we do the anterior hip, we place you on a special table. The table has a traction device that actually can pull the hip out of its socket, and this allows me to remove with a saw the proximal femur. Now the canal of the femur is hollow, and with special instruments we can work the implant into the canal. The table then moves that hip out of the way so that the socket area can be treated with a reamer. The reamer removes the cartilage from the socket area so that a new metal and plastic socket can be pressed into that space. The table then releases the traction, brings the hip back into the socket, completes the hip replacement without cutting any muscles at all. We work through an interval between the tensor fascia and the sartorius, and we don't cut any muscles, and that's why patients can recover so quickly. I've had many patients go home the same day with this procedure, which is quite remarkable, and most don't need to take any narcotic pain medications. If you'd like to learn more about this amazing anterior hip procedure, please come see us at the Scottsdale Joint Center.